Hi everyone, I'm Danielle Omo and
I'm Kristen.
And today we are here at the Thai Massage Jam going to learn about or work on our glutes and low back and help address glute and low back pain. How does that sound?
Sounds good.
All right, awesome. You ready?
Yeah, I'm ready.
All right, cool. So let's have you start face down. Okay, awesome. So Kristen's been having some pain in her low back right around this area. And what attaches here is basically all of these beautiful back muscles that keep us upright all come in and tie right around here in this lumbar region. Another thing is these are your glutes, our bottoms. And this is our sacrum. It's this little triangle area. This is where our spine comes in, connects to our lower body. And then all of our nerves come down through our sacrum and our sciatic nerve come down our leg. And that's usually where we get that low back, glute, and leg pain. So we're going to address that today. One of the things we first want to do is start by softening up our receiver or our partner and just doing some gentle rocking. How does that feel, Kristen? Good. So I'm just doing this by gently pushing on her glutes. You can also take a hand right on the low back and just rock back and forth. You just want to make sure that they're nice and soft and ready. So then I'm going to come around to the feet. I'm going to hand walk or palm walk up to seeing how her muscles feel, where her tension is. She's got some, you've got some in your calves. Got nice strong legs. And just palm walk up. Just really feeling the tissue below. And also saying hi to our receiver's glutes and hamstrings. How's that pressure? Good. Do this for gentle rocking as well. Get everything nice and loose. So once we've done that, I'm going to take my knee and bring it right here where Kristen's glute meets her hamstrings. So right in that nice little crease is where my knees are going to go. Come right here, press gently in. And there's a lot of different things that we can do here. One, we can just hang out here. How does that feel, Kristen?
Good.
Would you like more pressure?
Yeah.
Great, I can give her more pressure. We can do that by simply stacking, putting more weight onto my knees. I can come in, brace with my hands, and lift up my feet and put more weight on my knees like that. I know that Kristen has got a little bit more tension in her left side. So I'm going to gently shift my weight to my left knee and press and just hold. Does that feel, Kristen? Good. Would you like more pressure?
Good.
Okay. I'm just going to hold here for a minute. Super easy. I don't want to be over. Just sit back a little bit. But I've also got hands. What am I going to do with these things? I could text. Do my hair. Look beautiful. I could also work on my partner, my friend. Just do gentle hand walks and gentle pressure on the low back. Shearing off to the side. Just like that. How does that feel? Good. Cool. Now that I've worked those out, I'm going to bring my knees up onto her glutes, at the very top of their glutes. If we remember, here is our sacrum. Here is the top of our iliac crest, right there. This is our SI joint in that area. A lot of people have pain there, and that's because, again, those nerves that come down our spine come through our sacrum. Here's that sciatic nerve, comes right through there, through all these beautiful glutes and down the thigh. This is where a lot of that pain can happen. So what we're going to do, we're going to find that triangle, bring up, right there at the top of those glutes, both knees, and just sink in. How does that feel? Great. So I've got Kristen's sacrum right in this area. Here are her glutes, knees in there. I'm going to use the floor to brace myself and just lean in, gentle rocking till I find a nice point that needs a little bit more focused tension. And just hang out here for a minute. I can brace on her lower back. Or if I'm really bored, I'm going to put my forearms along her back like this as well. Lots of different things I can do to stabilize myself. Does that feel, Kristen? You like more or less pressure? Great. So just feeling where she's got tension, I'm going to scoop my legs down, my knees down, her bottom just a little bit more. Lean in. Find that nice, dense muscle material that holds all of our problems. Lean in and press. So you can stay here with your partner for as long as they feel comfortable, or until you feel, sometimes you'll feel the glutes will clench and then release, which is awesome and it feels amazing. You just hang out until you feel that, or until your partner's just like, you know what, I'm done, and then you're done. So then what we can do is we take our feet and we lean back and we sit back up on our feet like this. That way we don't put any unnecessary pressure or unexpected pressure on her glutes. We're going to come back in to right where the hams meet that glute, right there. And again, just going to hold, just like that. And press in. How's that feel? Awesome. Now, Kristen is very flexible, so super jealous. There are a lot of people that are very bendy. And to reach some of these front hip flexor muscles and attachments, what we can do is, Kristen, would you please bring your heels to your glutes? Thank you. I'm going to grab the heels or the ankles, and I'm going to lift up and press in to that glute ham juncture. And as I do that, I'm going to bring in traction her ankle and her lower leg. How does that feel? Good. Where are you feeling that? You feeling it in your hamstrings? Awesome. How about your hip flexors a little bit? Not as much? You're super flexible. For her, we can also bring her feet forward. See how they've crossed my body now? How does that feel? Good. Just let her stretch with that for just a minute. So normally I would hold a lot of these poses or techniques or moves, whatever I'm doing, a lot longer, giving Kristen's body time to really feel the deep work and then release. But we're just showing you a couple of little things today, and we've got some time limits. Would you mind rolling onto your back, please? Thank you. So I know that Kristen's left side has been bothering her because she's been doing some awesome workouts. She was telling me about these amazing squats that I can't even imagine doing. So we're going to help her out with that, with doing some just hip movements and a little bit of focus on her quads. So as you can see, I put my foot underneath her knee. I've turned my foot in so it's not as sharp underneath her knee. I'm going to take my other foot and just gently press into her hip. So just like that. And just do some gentle rocking. Now this foot, my left foot, is just acting as an anchor or stabilizer for her leg while I move her hips around. How does that feel? So right now I'm just rocking, but knowing her and she needs a lot more attention because she uses her body, we're going to do a little bit more aggressive rocking. And as you can see, her hip is popping up with all of that movement. How's that feeling? Good. Awesome. So once I've got this area warmed up, I'm going to come in, I'm going to pop up the hip like this and just hold. How does that feel? So here we're working on glute medius, which is one of those, more lateral outside glutes that can get really tight just from sitting, living life, all of that kind of stuff. I'm just going to hold, rock and hold, and then here again. So now I'm pressing into glutes. Again, my left leg is more of a stabilizer, but what I can also do is if I want a little bit more, I can pull and get a little bit deeper, more of this kind of tractioning to get deeper into her hips. How does that feel? Awesome. So then just come in. I'm going to do some gentle foot compressions. And basically, I'm using the nice broad part of my foot and wrapping it around her quad, just like this, and pressing in. A lot of times you will feel some really dense tissue. Quads are always worked. We use them. We walk around a lot. So you want to be very gentle and pay special attention to the quads. And just holding. Again, left leg is my brace. I can also do like this kind of traction or torsion. If I want more pressure, just push in like that. If I want less pressure, just back off, or I can just push with this foot. It's a little hard to see because they're just such subtle movements, but that's what we do. So it's like this, hold, and release. And just go down that leg, right along this nice quad line right there. Press in and release. Just like that. Our spider friend is back. How does that feel? And then another really great stretch for the low back is one where we bring it up, bring our legs up, do a gentle range of motion, get that nice lubed up joint in there, synovial fluid all squishing around. We're going to bring our leg across, put our heel to right around our knee, and then big deep breath in. We're going to roll her this way. How does that feel? Awesome. Now your receiver might feel some tension here or back here on their bottom. Both are good. If it's too uncomfortable here, you're going to push more towards this direction instead of that direction. That'll take some of that pressure off. Kristen, she's very flexible. We can do a little bit more. There we go. How does that feel? Good. Awesome. Then, just like Kristen did, because she's amazing, take this arm, spread it out. You'll get this beautiful full body twist just like that. Breathe in and out. And take my hand here, press along pecs. Not our goal, because our goal is low backs, but you know, I'm here, why not? So once we've done that, we can take our hand, lift up our knee, and then roll our receiver's glute onto our knee here. Do that, right across. How does that feel? Good. Awesome. So what I can feel with my knee is right at the edge of that sacral border. I'm just going to move her leg around. Once I've got it in a good position, I'm going to grab her leg, love your leg, I'm going to hug it, and I'm going to move. And what that is doing is here's her glute, here's my knee. I'm pivoting her glute all around my knee. Super easy, just like that. How does that feel? Sure. Kristen also has amazing flexibility. So to add to it, I'm going to take my other foot and cross press. So I'm pulling with this arm, pressing with this foot. Just like that. How does that feel? Good. And again, this kind of stuff would do a lot more, hold it a lot longer. But we're just showing you a little bit of stuff in a short amount of time. Okay, and down. So now we're going to switch to the other side. Okay. Okay. Again, we're going to come in, foot underneath knee. We're going to just do that gentle rocking again. So what this rocking also does is it helps to get the brain to kind of relax around what we've got going on. Sometimes we're so tense, but during this rocking motion, it can help things relax without really having to force it. And what that also does is that gets some really great gentle movement along all of those erector muscles, everything in your lumbar, everything that attaches to your spine, all that stuff is now getting some nice gentle movement while we're doing that rocking. And hold just like that. Get a little bit more movement on this side. So we can go a little bit deeper. How does that feel? Awesome. And then back to the rocking. Again, getting that movement along the spine, along all of those rotatores and multifidi, lots of names for lots of muscles that are in our back. Then I come in and then do this, pop up just like that. Now again, Kristen, she's got lots of extra room. Is that okay on? Good, right there. She's at her edge, which is great. I'm gonna hang out here. Let her feel that. Let her work around that, and it's all good. Just to add a little bit for her, I'm gonna add a little bit of an arm traction, because again, she's so bendy. Jealously bendy. Jealously, I don't know how to say that word. Enviously. Just pressing in and then relax. So I'm gonna come and do these beautiful broad quad compressions and IT compressions. And the reason why we focus a little bit on quads is because you can see quads are large, they're like half our leg. And what they'll do is they'll pull on our hip and pull them forward, which then stresses out and stretches out all of those wonderful lumbar muscles. So they start getting all upset. Like, guys, calm down. So we got to tell quads to calm down too. So again, I can feel where Kristen's got some tension. And pull back on now my right foot, pressing in more with my left, back and forth. Kind of like a wave motion. Listen to your partner's breathing. On inhale, relax. On exhale, we're gonna push. Just like that. If I find an area that needs extra special attention, I'm gonna take my heel, just press in. Again, I can adjust the pressure down or up. Just, hey, we're here, a little bit of movement, just because I find stuff. Now we have some beautiful movement in Kristen's hips and legs, which is awesome. Now we're going to go and do our stretches. We've warmed up the hips. Now we're going to do some more stretches on this side. And again, I'm just holding in. Her femur, her big leg bone, and her hip bone is just a little bit north and a little bit west of where my foot is really, really pressed in. I'm not pressing directly on her hip bone because that feels uncomfortable. Nobody wants a foot jammed into their hip bone. I mean, do you, Kristen? Mm-hmm. I mean, okay. So she doesn't want it either. So that's one thing that we just have to keep an eye out for is we don't want to find the hip bone and just go bam, or find that hip joint and go bam. Be very gentle. We like our receivers usually, so we want them to feel good. So once we've got those hips all nice and warmed up, we're just going to, again, do some gentle range of motion. Get that synovial, that joint fluid, coating the inside of that hip joint. We're going to bring it over. Take a deep breath in And out. Good job. So sometimes your client or your receiver, you can brace their hip with your leg. This allows for them to have the stretch without having to fight their body for it. I think this camera might work too. I'm going to do this. So now what I'm doing is I'm pushing her down and this way to just help it open up that lower lumbar region, that lower back region, because they can get all squished together. I'm going to brace her hips with my legs. Do this nice low back, full body twist. And really, really get that stretch. How's that feel? Awesome. So then once we've done that, and you know, if your receiver has pain here, you can work here too while they're hanging out. Lots of different things we can do. But what we're going to do now is lift that knee up, put her bottom back onto now my left knee, bring it up and over, and open up those hips. How does that feel? This side is definitely tighter. So I love Kristen's leg. I'm going to bring it with me wherever I go as I do this range of motion. Such a beautiful leg. Thank you for letting me have it. And because Kristen is so bendy, again, foot across, and just lean back and hold. How's that feel? Okay. Once we do that, I'm going to bring her up and over. Set your partner down. You don't want to drop their legs. Usually, again, we like our receivers. I'm going to be nice and gentle with that. Another very easy thing to do is grab your receiver underneath their ankles and lift up. How does that feel in your knees? Is that okay? Good. So super great, easy on the knees. We're going to just gently traction that low back on the knees, just like this. Just gentle traction. How's that? And then just for good measure, you could bend your knees for me. Bring up. Okay. And I'm going to bring your knees to your chest. Then cross. We're going to cross just like that. You see, knees on the other side. I like to put my feet right up to their bottom. And just gently press in. How does that feel? So what this is a nice low back stretch, releasing all of that tension in those lumbar muscles, everything along the spine, everything along the glutes, SI joint. Great finish. And with that, and that's it. How do you feel?
Good.
Awesome. That's it. Anything else?
Take a little bathroom break and then switch partners?
I think that's a great idea.